Great Indians. Susrutha was an ancient Indian physician. The Susrutha Sanhita, a treatise ascribed to him, is one of the most important surviving ancient treatises on medicine and is considered a foundational text of Ayurveda. The Compendium of Susrutha locates its author in Varanasi, India. In 1907, an influential translator of the ancient Indian epic the Mahabharata, named Bhishagratna, argued that Sushrut was one of the sons of the ancient sage Vishwamitra. Bhisagratna also asserted that Sushrutha was the name of the clan to which Vishwamitra belonged. In Chapter 7 of the 5-volume History of Indian Medical Literature, published in 1999, physician-scholar Gerard Jan Moilenbelt covers a variety of theories on Sushruta's identity and the Susrutha Sanhita's publication history. The name Sushruta is listed as one of 10 Himalayan sages in a treatise on medicinal garlic that was included in the 6th century CE Bauer manuscripts. Sushruta attracted a number of disciples who were known as Sushrutas and required to study for 6 years before beginning hands-on surgical training. Before starting their training, they took a solemn oath to devote themselves to healing and to do no harm to others, often compared to Hippocratic oath. After the students had been accepted by Sushruta, he would instruct them in surgical procedures by having them practice cutting on vegetables or dead animals to perfect the length and depth of an incision. Once students had proven themselves capable with vegetation, animal corpses, or with softer rotting wood, and had carefully observed actual procedures on patients, they were then allowed to perform their own surgeries. These students were trained by their master in every aspect of the medical arts, including anatomy. Ancient poster by Sushruta, given in Sushruta Sanhita showing surgical instruments, in which most of them still continue to exist today. Sushruta wrote the Sushruta Sanhita as an instruction manual for physicians to treat their patients holistically. Disease, he claimed, was caused by imbalance in the body, and it was the physician's duty to help others maintain balance or to restore it if it had been lost. To this end, anyone who was engaged in the practice of medicine had to be balanced themselves. Sushruta describes the ideal medical practitioner, focusing on a nurse. In this way, that person alone is fit to nurse, or to attend the bedside of a patient, who is cool-headed and pleasant in his demeanor, does not speak ill of anyone, is strong and attentive to the requirements of the sick, and strictly and indefatigably follows the instructions of the physician. Sushruta's medical prowess is exhibited through his writings on rhinoplasty surgery, involving nasal reconstructions using skin from the patient's forehead or cheek, often for criminals punished with amputations. Based on reports in the October 1794 edition of the Gentleman's Magazine, published in London, Indians maintained Sushruta's surgical practices until the late 18th century.